the director of the call center in the city of Knoxville. Because when you take central intake and you boil it down to its simplest form, it is indeed a call center. And so with their help and the help of our customer focused government people, we began to look at how we could improve the performance of that center. We've implemented various steps to help, and let me cut to the chase of the results. We today have an abandonment rate that is less than 5%. It at one time was close to 5 times that number. The time it takes for you to get to a live person averaging right now around 18 seconds. That too, a pretty significant improvement. What we had previously, if you called, you received a recording that lasted close to a minute and a half, which is a long time. And then if you endured that, you faced a 15-second silent period. And I'm sure you've experienced that on the phone. If you're on the phone, 15 seconds is a long time not to have anyone talking to you. Consequently, we had a number of people who would hang up and thinking they had been disconnected, redial, and the cycle would start again. So we have reduced the recorded message that you received down to something less than 30 seconds, I think, today. And again, as I said, we've improved the abandonment rate and the average time that it takes for you to get to a person. How we did that was through various tools. One, we have implemented a staffing model which has not increased our staff, but has deployed the staff at the time where we get the bulk of the calls, and it runs some routine to that, and so we're able to staff in accordance to where the volume of calls come in. Our employees now have every day what is called a quick meet, where they meet, talk about the activity of the day, they review the numbers of the previous day, how well we're doing in handling the call volume that comes through. We've equipped our personnel with headsets that allow them to be mobile so they can move around and do other things, but at the same time be able to respond to calls. We've looked at their ability to get the information into the system, and that has required us to have some employees go through training to be better at typing and the input of that information. That is likewise something that we're looking for now, and one of the minimum requirements is we hire people into that area, along with experience in child protective services. So we've done a number of those things, including things like having them have a map of the state of Tennessee so that they would know where a town was in one of our 95 counties. That helps for them to have some sense of the geographical location of a call that might come in. So a combination of several factors have led to those improvements, but we're not finished. There's much yet to be done. In the private sector, in the banking world, you look for an 80-20 rule. 80% of your calls answered in 20 seconds or less. We're focused on trying to have a 90-10 because this is more a 911 environment. So we would like to strive toward 90% of our calls being answered in 10 seconds or less, and we will continue till we get there. But this is an area of good improvement. It is paying dividends for us today, and we're determined to make it even better.
Also, Mr. Chairman, they've had headsets that we've got there, new screens. We're rearranging the space to where it'll be more friendly to the workers there. We're looking at new skill sets on what we can do to bring people in. You know, everybody that works in the call center doesn't have to be a case manager. And you know, that's That's a very difficult job, but there's a lot of people that might have good people skills that can answer phones and do, as you know, better than anybody. And then if they need a problem for the case managers, then they can refer them to them. So we think this is a big home run. I mean, it was one of the things that the courts were interested in when they came here, what was happening to our call center and our intake center, and I think that we met with them last week. They were satisfied with what we were doing. In fact, they told us that if they'd had this meeting in January, that they wouldn't have been back to court. So we felt very good. We're going to be visiting with them in New York next month. So it's a huge improvement, I think, over just since the first of the year, Mr. Chairman. Department of Children's Services provides services for 3 core programs: Child Protective Services, Child Welfare Services, and Juvenile Justice. Child Protective Services operates child abuse hotline call centers, investigates cases of abuse and neglect, evaluates child safety through investigations and assessment, and determines resources or services needed and places children in care if needed. There's non-custodial services provided also for counseling, parenting, A&D, and provide one-time temporary basic needs services. That's if we have somebody that comes in and they've got a basic need, like they've got to pay a water bill or buy a bill, we got to buy them some clothing or something like that, then we've got funds to operate to do that with, Mr. Chairman. Child Welfare Services works to bring permanency to every child while ensuring safety and well-being, provides child and family support services, it finds adoptive homes for children in full guardianship, supports a diverse array of custodial services for children in care. These child welfare programs include foster care, extension of foster care, adoption services, post-adoption services, medical and therapeutic services, and provider network development. Juvenile Justice, which serves youth who have committed delinquent offenses. These services range from community diversion to custodial care. It operates youth development centers across the state. YDCs are accredited and have been for some 21 years. And if you've got just a minute, I'd like to ask Albert Dawson that heads our YDCs up to come and address you and tell you just exactly. And we do have good vacancies in those now, Mr. Chairman. Would that please the chairman?
Please introduce yourself and state your name for the record.
Excuse me. Good afternoon. I'm Albert Dawson, Deputy Commissioner of Juvenile Justice. And as Commissioner said, the services within our division range from community intervention services, which would be prevention or preventive programs that are in the counties, up to our most secure facilities, which are the youth development centers. On the prevention end, we provide grants to 46 counties to develop programs that are designed to prevent children from coming into state custody. Those programs include truancy prevention services. Carroll Academy in West Tennessee is one of those programs. And again, they're designed to provide services in the community that would prevent children from coming into state care. We also have probation services in a number of counties where when kids come to the attention of the courts, there's an option available where our case managers will actually work with the children, parents, and the school system to make sure that families have services available, again, to address the needs of young people without coming into state custody. If they actually come into state custody, we contract with a number of providers to offer services to delinquent youth. And then for the more serious offenders, we do have the youth development centers. Within those centers, we have the maintenance type services, which would be your medical, your dental, your transportation, and so forth. But I'm most proud of the treatment services that we offer. We have a counseling staff at each one of the facilities. That when the young men come in to care, There's an assessment, and based upon that assessment, decision is made about exactly what services they'll need. And we have counselors there to work with them to provide individual counseling, group counseling, and so forth. Each one of the facilities have contracts with area agencies, such as Woodland Hills here in Nashville has a contract with Vanderbilt to provide the more therapeutic type care. That is individual counseling, group counseling, family counseling, alcohol and drug, as well as sex offender. And again, these are the more serious cases, the kids that need to be in a confined setting, and the services are offered there. But I'm also proud of the academic services that we offer. Kids come into our system often have had trouble in school, and so we're capable of providing everything from remediation on up to first year college. We were recently recognized, our GED programs were recently recognized as having the highest passing rate of all GED testing centers throughout the state.
It's all public schools, everything.
Right. And Mary Meadow can give more information about that, but we're very proud of that service. And we also offer credit recovery within the school programs. And I firmly believe that education is the key to success, and it's the key to turning young people around. As Commissioner indicated, the facilities have been accredited for the last 21 years. They're accredited by the American Correctional Association Commission on Accreditation. And in order to achieve that, there are about 435 standards that our programs have to comply with. Some of those are mandatory standards related to fire safety and first aid care and so forth. And you have to comply with those standards in order for the audits to continue. The others are related again to academics and so forth. Well, our last 3 audits, which were back in 2010, each one of the facilities scored 100%, which is very rare. And there are 59 facilities nationwide that are accredited in 18 states. And 3 of those facilities are here in Tennessee, and again, they scored 100%. The Wilder Youth Development Center, which is in West Tennessee, is the next one to be audited. We're excited about that one because it's our first opportunity to be evaluated against performance-based standards, which is a little different than what they have been in the past. So we're looking forward to that opportunity, and hopeful that we'll score a representative score as well coming here in April.
Thank you.
Mr. Chairman, it's
Excuse me 1 second, Commissioner. Representative Calfee, you wanted personal order?
Thank you, Mr. Chairman. I wanted to, first of all, I wanted to echo what you said about your confidence in Commissioner Henry. I've known him for a long, long time. And if I could go out of order, I'd like to recognize some of my constituents.
Yes.
Commissioner Henry being the first one, and his lovely wife Pat in the pink in the back, and my wife Marilyn over here. Thank you, Mr. Chairman.
Thank you.
Mr. Chairman, it's not only, important that we have good facilities, but it's also important to reduce the size of those. And Tennessee led the nation from 1997 to 2010 in reducing populations in institutions. And of all the 41 states, we decreased. We had a huge decrease. It dropped by some 66%. Now, one reason that's important is because the more you mix difficult kids, the more their difficulties are. I mean, people, they feed off of each other. It was like Tennessee Prep School when I was growing up, and they continually threatened me with sending me to reform school. That's what it was. It was a 1,500 kid facility here in Nashville. And if you weren't tough when you got there, you were when you left. And that's why foster care is so much better than these places if they're eligible to go, because you go to regular school, you go to regular doctors, you have regular friends. It's just so much better to be part of the family. So we will continue to get these kids well and hopefully be able to get them out of those things as quickly